If you're watching this video, then you or someone you love suffers with a dizziness or a balance disorder. Hello, my name is Dr. Keith Lynch. I've been practicing in Central Virginia since 1998. If you're suffering with a dizziness condition, then I can tell you this. We evaluate dizziness patients, and when we do so, we leave no stone unturned. We evaluate you both metabolically and neurologically. Let me explain that and break that down for you. Metabolically, what we do is we start off with screening paperwork that lets us know exactly what you're experiencing so that we understand your condition. And then what we do is we review those systems so that we know exactly which tests need to be run to find out which part of your body isn't working right. You see, balance is a complex interplay between the eyes and the middle ear, the cerebellum at the base of your skull, which has to do with balance, proprioception, and coordination, your spinal cord, and the sensation from your feet. All of those things need to be working properly and appropriately for you to feel well balanced. So if you're having a balance issue, one of those areas is not working properly. In our office, we leave no stone unturned to find out exactly what's causing that. So what am I referring to? Well, perhaps you've already had blood work and you were told everything's normal. I would probably disagree with that. I encourage you, when you make your appointment, bring in your most recent blood work, because I do not use the reference ranges on the side of your blood work. What we use is functional optimal ranges, which are much tighter than your reference ranges. Reference ranges can be very wide, and they just mean that over 100,000 people have come in and their ranges are out here, and they just take a little bit off the ends and say, well, this is the average of what we see. We're actually going to compare you to what would be most healthy for each individual lab value and look at it that way. So bring in any old lab work that you have, because we'll probably already start to see issues with it that tend to lead us into what needs to be done next. With a dizziness condition, we do specific blood work to find out what's causing it. So we'll do a CBC, or a complete blood count. We'll also run a complete metabolic panel. We'll look at your lipid panels, but we also look at your thyroid panel. Not just TSH, but all the other 9 markers that can be there, so that we know exactly what's going on with your system. Another thing we'll do is we'll also look at how well your brain and your adrenals are working with what's called an adrenal stress index. Now, especially if you're someone who doesn't sleep well, either you have problems falling asleep or staying asleep, fast movements cause you to feel dizzy or unbalanced, your adrenals are very important to be evaluated for this, because your cortisol-melatonin relationship needs to be addressed. It'll let us know how well the hippocampus and the paraventricular nucleus are working in the brain, so that we'll be able to identify if those are the areas that need to be treated. Another thing that we'll be looking for is we'll be looking to see whether or not you have any food sensitivities. If you have food sensitivities, what's going to happen is it's going to create an inflammatory and immune response by the body, which can cause all kinds of problems which lead to dizziness disorders. Now, as I'm talking about this testing, there's something important that you need to know. Something called medical necessity. According to your insurance company, if you have health insurance, medical necessity for these type of testing falls on you. What does that mean? Well, that means you are going to be responsible to pay for your testing. Your insurance company, your employer, your doctor, none of those people are trying to get down to what is the cause so that you can be well. That is what I am talking to you about. That is our goal is to identify the cause of the problem so it can be addressed. So the bottom line is, it's your responsibility to find these things out. Another thing we're going to be testing for is autoimmune conditions. Autoimmune conditions are when your body is attacking itself. And we do that through specific testing to find out, through blood work, whether or not your body is making antibodies against itself. And if it is, our next job is to find out what is the trigger of that and help you stop introducing that trigger into your life. The next thing that we need to do is we need to talk about the neurological aspect of care. In other words, we're going to be testing the frontal lobe, the temporal lobe, parietal lobe. We're going to be testing your cerebellum. We'll be testing the canals in the inner ear and your vestibular system, because we need to know exactly which area of the body isn't working right. Dizziness issues can be centrally located, meaning it's coming from a problem in the central nervous system, or they could be peripheral. Peripheral means it's in the ear, or it's in the spine, or it's coming from a peripheral neuropathy where you can't feel your feet anymore, and because of that, you don't get any input into your brain from where your feet are, and that takes some of that input out about whether or not your body's well balanced. All of those things need to be evaluated and looked at to find out exactly what's causing your dizziness issue. Another thing that we'll be looking at is whether or not you have a proper functioning VOR. Now, a VOR is your visual ocular reflex, which means if I closed my eyes and spun, what I should be able to see is I should see that nystagmatic response, or the eyes should bounce away from the direction that I'm turning and looking. We have specialized equipment here in our office in the form of specialized goggles that you put on your eyes, and what you're going to do is, in the darkness, we'll be able to see what your eyes are doing, whether or not you're having an appropriate visual ocular reflex. If not, it tells us which part of the central nervous system isn't working right. We can also check your semicircular canal function with these goggles on, where we can do what's called a Hallpike maneuver and identify which semicircular canal has debris in it, causing overexcitation of those nerves and sending in aberrant information to the central nervous system, which basically means everything in my body tells me I'm standing upright, except I'm getting too much stimulation from this side, which is causing my eyes to move, and it makes the room look like it's spinning or moving. That is what's called BPPV, or benign positional paroxysmal vertigo. These conditions need to be evaluated so you know whether you have a metabolic problem, a neurologic problem, or both, so that we can tailor a specific treatment plan to help you get well and stay well. My name's Dr. Keith Lynch. I look forward to helping you.